last night. Here now with their reaction to the speech and a lot more, Congressman Anthony Weiner, member of the Energy and Commerce Committee, and Congressman Peter Roskam, a member of the Ways and Means Committee. Congressman, good morning to you both.
Good morning.
Congressman Weiner suggested that the president's mission last night was not necessarily to bring Republicans into the fold, but more congressmen and senators like you who maybe are to the left of him. Did he do anything to change your mind?
Well, he didn't have to do much to change my mind about the idea that we need to solve this problem. I'm more convinced than ever than the argument that he made that we need some competition for private insurance companies that, left to their own devices, they've shown over the course of 2 generations now, healthcare inflation is going to keep going out of control and people that need care aren't going to get it. But I do think, though, that he did make more than a few hat tips to the Republican side of the aisle and offer to keep an open mind on their suggestions. You know, we had a rough month of August where there was a lot of yelling and shouting going on. I think this was the president stepping in and saying, okay, it's time for the adults in the process to sit down and get to the hard work of solving this problem.
Right, but you made some news last month or in recent weeks when you stuck to your guns on the public option. He seemed to suggest that there might be some wiggle room there. Have you moved in that direction at all?
Well, look, he made it very clear that you need to bring down costs, and I think that Peter and I both agree that you need to do that. The only element in his plan that really does that in a concrete way is the part that gives competition and choice to consumers via the public plan. If there's no public plan, many, many Americans won't have any choice as it's been described. So I think a public option, he made a pretty good argument for it, and I'm going to keep fighting for it.
Congressman Roskam, as a Republican, what's it like watching this, knowing that there's a strong likelihood that your vote, I guess in some circles you could argue, may not matter much?
Well, I wouldn't suggest that. I think that this is a complete jump ball right now. I mean, President Obama came in with a goal of a pretty heavy lift, and that was to keep the political left in place and at his flank, but actually to try and move the debate beyond the August consternation that people have. I don't think that there's any question that the American public fully understands the government-run public option insurance program and have wholeheartedly rejected it. We've seen it through 44 members of the Democratic Party in the House who have said they're not going to vote in favor of a bill that has it in it, and I think you see it in the polling. So the challenge that the president had, and I think he really kind of missed the opportunity, frankly, was to hit ultimately the reset button. And the reset button is, say, we're going to drop the public option and move on. Let's go to where the public generally wants us to move, towards increasing access and driving health care costs down, but not at the expense of a public option.
So you think anything short of divorcing himself from that element is falling short of success, and that's clearly not what happened last night, right?
Well, I think that the president has, if his goal is to stay wedded to the public option insurance plan, I don't think he's going to be able to pass a bill. I think if he wants to sort of recast the vision, and that is driving costs down and pursuing other elements of accessibility, great. There's I think, a wholehearted desire on the part of folks on both sides of the aisle to move towards that goal, but a public option can't be a part of the mix.
Congressman Weiner, I'm sure you are as frustrated as we are on the outside trying to figure out how a public option alters the survivability of a bill, especially when Hoyer and Pelosi can't seem to agree on what's passable and what's not.
Well, I'll leave it to someone else to do the punditry. This is kind of like a Rorschach test, this speech last night. Peter and I had different interpretations, and so did you, of the public option. But look, here's the bottom line. If you figure there are 3 things that we need to do, one is make sure people who aren't covered get coverage. The second is making sure people that have insurance don't lose it for reasons that they shouldn't. The third, perhaps biggest elephant in the room, is how you control costs. If you don't have competition, which is the marketplace making these decisions, if you don't have that, what do you have? And so, frankly, we've yet to hear from the other side of the aisle what you want to do. You know, they say tort reform. Well, the CBO has taken a look at that and said in all 46 states that have tort reform, rates don't go down, they go up. They say they want interstate competition, but no one is suggesting that the insurance companies lose their antitrust exemption. What is the other side proposing on competition? Now, as you know, because I've been on your show to say it before, I think we don't go far enough. I believe in a single single-payer system like Medicare for all Americans, and people like Medicare and understand it. But putting that aside for a moment, because the president is not endorsing that, if we don't have the public option, I say this to the president and to Peter, what do you want to bring down prices?
Well, I think there's two things. Let me speak directly to the tort reform issue, because I think the president came up short. I mean, even the president acknowledges that tort reform will bring costs down. He did, as Anthony said, a hat tip to the GOP, but it was just essentially authorizing the Secretary of HHS to do a study. Where tort reform has been in place in places like California and Texas over the past 30 years, premiums have increased, yeah, but they've increased at a much less vigorous rate than in the places where it hasn't. The other element is this notion of opening up the competition across state lines. I think there's no question that if you can bring a robustness to competition and allow people to pool together, by definition, that's going to change the debate vis-a-vis insurance companies. And then the final component, I think, to Anthony's point on cost, is focusing in substantively on the waste, fraud, and abuse question. The president acknowledged that there's tremendous fraud in Medicare.
Congressman Roskam, really quickly, is on the Congressman Wilson's heckling, is he in any kind of trouble today?
Well, I think he's going to have a tough day. It was an inappropriate remark. He apologized last night, but he's going to have a tough couple of days. It wasn't a wise thing to do.
We appreciate both of your time as the debate continues anew. Congressman Weiner and Roskam, thanks for your time this morning.
Thank you.
Thank you.